La presentación va a ser en inglés y por eso también voy a hacer la introducción en inglés, así que I change to English now. Welcome everyone. This is another seminar on this cycle that's organized together with the Cátedra de Energía at the UPV and also Ingenio, Institute for Knowledge Management and Innovation. And we have today Aline Chiabai, I hope that was pronounced correctly. She is a researcher at the Basque Center for Climate Change, and her main research line is on economic evaluation of climate change impacts on human health for policy guidance. So she's been working on this field for a while. For instance, she currently has a fellowship at the University Ca' Foscari in Venice, working on the economic valuation of climate change impacts on biodiversity ecosystem services. And she's worked with the European Investment Bank as a consultant for Corilla, the consortium for the management of the coordination center of the research activities related with the Laguna of Venice. So she's had quite a lot of experience, both in more applied research and, well, doing more basic research. She is graduated in economics at the University of Trieste. She also holds a master's in environmental quality management and a PhD in transport, traffic, and environment. We are looking forward to your presentation today, and the floor is yours.
So thank you very much for inviting me to this seminar, cycle of seminar. Especially, I would like to thank Carolina to give me this opportunity, and Ingenio. So it's an opportunity to share with you my last view in my research. Let me share the screen in the, okay. Okay, so what I would like to share with you today, it's some points of reflection, actually, because it's a starting research on how we can go deeper about the links between health, sustainability, economics, especially in the current situation that we are living, especially in the COVID pandemic, which make us think more and more about these links. So what I would like to propose as a new approach, it's not new in reality, but we are working on it to adapt it. It's the One Health approach. And it might seem quite obvious to recognize that there is a link between human health, animal health, and environmental health. And it seems quite obvious, especially in the current pandemic. In fact, this framework has been proposed in reality to tackle with emerging infectious diseases and mostly from zoonotic origins. But what I'm arguing it is that we need to go beyond that, and in the current crisis that we are facing because of aging population, globalization of unhealthy lifestyles, climate change with the extended contamination of the environment, we need to go further in this relationship. So what I would like to show during this presentation is to drive you through some reflections on these links and to see why this is important and how far we can go in the finding the causal relationships between these links. So I would like to start with one main problem that sometimes is slightly disregarded, especially from our side when we are looking at climate change impacts on climate change. And I would like to highlight the importance of non-communicable diseases. These are the chronic diseases like cardiovascular cancers, neurodegenerative diseases, or respiratory diseases, digestive suggestive. And so the last global burden of disease in 2017 for Europe has estimated that 91% of death in Europe are actually attributable to these chronic diseases, that we can see the share in this figure here. So this is quite a big problem, and this is in every country of the world. I would say that only in Africa, infectious diseases are still higher than chronic diseases. But the problem is not just because of the mortality, but of the age at which we get first diagnosed with these chronic diseases. And this is getting early and earlier. I think it's around 50 years or 49 years that the people on average get diagnosed with the first chronic disease in their life, which suppose that then for the rest of their life, they have to live with that burden. And this is increasing. Has a huge impact in terms of dailies. This is a measure that is estimating the disability adjusted life years, which means the sum of years that are lost not only because of mortality, but because of years of productive life lost. But I want to make the point that it is not only a question of productivity, but also a question of quality of life and the burden that each one has to take on this. So climate change is on one side exacerbating these impacts, because when we have heat waves, for example, we have more cardiovascular diseases, respiratory. It's actually an exacerbation of these impacts, and those people that are already suffering from these diseases are more vulnerable. And on the other side, population, I want to make the point, the population debilitated with all these diseases are not going to be resilient in face of the new challenges of health risk posed by climate change, but not only. We have seen in COVID-19 crisis, the people that are more vulnerable, and mortality was especially seen in those affected by these diseases. So that's a big point in terms of cost of the society as well. If you can think on individual and household, in terms of expenses, but also personal burden, as I said, in terms of healthcare system with a very expensive treatment, and national economies, because we are losing productivity, but not also efficiency at work. So this is a huge problem. And as an economist, I was working on putting, money on these items and convert everything in a monetary terms in order to demonstrate actually that we have to do something, because otherwise we will lose so much money. But that we go in some inconsistencies, because, for example, when we look at individuals, all the problems related with these diseases, in terms of, for example, of not being able to contribute to the society how much as I want, or in terms of stress, how do I monetize these values? It's a big challenge. I'm not able to do that. So I was started to thinking of other approaches really are needed. And especially we need to know, okay, the first question would be what we mean by health and well-being. And in this crisis, I think this is quite a question that we need to start posing. So what I found really it is the original meaning of this word is in Old English means the state and condition of being sound or whole. So we found this work of wholeness, completeness. Of course, health has different meanings for each of us. So and there are many definitions that have been used. So we can go back maybe to Hippocrates, who is the father of modern medicine, and he was saying that basically conveying the message of health as a balance in the body versus disease, which means an imbalance. And he stated like two things important, that the health is related to environment and behavioral factors. So then, I mean, I go directly to the 19th century, where we have been proposed what is the traditional medical concept of health. So we are in a moment in the 19th century where we have started all the advances in medicines, science, psychology. So we are discovering cells, microorganisms, genes, molecules that can cure, especially, infectious diseases. And this vision has actually contributed to a conception of health, which is like a state of the absence of disease. So either you have symptoms and so you have a disease, or not. So these are observable phenomena. And it is actually contributing also to currently the medicine, how it is organized. We have different specialization, actually. If we look at specialization about respiratory diseases, about cardiovascular problems or digestive system, and all these are seen as different systems, not even interconnected one with another. But this view was in reality proposed till 1950. So then we get what it is known as the cornerstone of health definition proposed by WHO. During the first conference, international conference in New York about health in 1946, and it was signed by 61 states. And the definition was health as a complete state, a state of complete physical, mental, and social well-being, and not merely the absence of disease. So here we go beyond, in reality, this conception of health and disease to have a more holistic definition. So if you see, we are pointing not only the physical health, but what will be later named as determinants of health, social, physiological, economic, political factors as well, and the concept of well-being. The problem, however, with this definition, it is that it is quite broad. It has been like criticized because measurable, unrealistic, maybe more a definition of happiness than in reality health. And actually, then also someone have a critic how we can define a complete physical, mental, and social well-being, which means that we are all ill, basically, because who can claim to be in a complete like health defined in this way? So this would in a way also contribute maybe to the abuse of medication and things like that. This is one of the critics among many others. So this has then brought basically to various proposals of adaptation, and the most institutional of this proposal is the Ottawa Charter. Proposed in 1987 because of all these critics, and to go a bit more focusing about what is health. So we have two concepts here. First, the idea of promotion of health. Promotion of health finally as something positive. It's not only negatively said as disease, so it is the idea that we can do something to improve our health, and it is in our power. And in fact, it is named as a process that enables people to increase control over their health. So the idea of empowerment of people. So it's not to leave this control to the healthcare system. So I leave that power, that capacity that I have to other people, but I try that I am the responsible person to try to get over this. So it is also specified as the ability to realize aspiration, needs, change and cope with the environment. So be able really to, when there is a crisis in whatever type, I can get the best out of it, and I can really satisfy what is my profound aspiration of contribution of the society. So this is a quite a new and powerful definition of health. And the second important thing is that in order to realize this, the prerequisites that have been stated are those that are then called the determinants of health. So the need for peace, shelter, education, food, a stable ecosystem, income as well, of course, social justice and equity. So one important thing it is that the good health is recognized here as a major resource for social, economic, and personal development. And this was like proposed in reality within industrialized countries. The problem is that these things then are difficult. I mean, this proposal has been made also to face with the increasing chronic diseases that I was saying, that was already seen in that period, because we started in that period to see that chronic diseases were more important than infectious diseases as leading cause of death. So let's go a bit more in deep in what are these determinants of health. So obviously we can say that biology and genetics, it's quite like recognized, like inherited conditions, gender, age, etc. On the other side, we have the healthcare with the medicines, technology, science, healthcare providers. Then we see on the right bottom side, the environment. The environment is also recognized as we need like uncontaminated water, clean air, fertile soil, a stable climate, a good access to green areas. And then on the left top side, we have those that are the social determinants, like income, employment, working conditions, education. All these are quite also obviously interacting one another, because a person with a higher income, with a higher income can have also a better employment and working conditions and better housing. And these factors are also structuring lifestyle choices, which means that individual behaviors like diet, the doing physical activity, consumption of alcohol, etc. So this is why like lifestyles choices are embedded really in these social economic factors. And we have seen the importance in many studies, for example, that we have been doing also, how the consumption of fruit and vegetables, for example, is directly linked with education, because a better education is basically offering better opportunities in terms of income, so which means a better knowledge and a better motivation to change habits. So all these factors are interrelated. So when we come up to see which is the weight of these in health, there is an interesting report. There are been many tentatives, and one of these is the Canadian Institute for Advanced Research, which showed basically that the social and economic environment is responsible for 50% of the population health status. So together with the physical environment, we get 60%. So now I don't want to, go and argue about the percentage, because it depends also of any geographical and many other conditions where the study is done. But it takes like the meaning that the measure role that is that is ruled by these social economic factors, and the fact that we should go from a healthcare system that is based on cure illness to a prevention that is going to addressing these social determinants. So now, as an example of the importance of these social determinants, I would like to show like the relationship, like two indicators for mental health that are important in climate change, also in infectious diseases, and many of the problems, and in neurodegenerative diseases as well. And these are stress and social interaction. So there are plenty of studies about this. I will show just two of them. So the first here that you have is a systematic review on a meta-analysis of 148 prospective studies. And this has shown that people that having stronger and of better quality social relationship have a 50% increased chance of survival compared to people with a weaker social relationship. And the interesting thing in this study is the magnitude, basically, of this effect is comparable to when you look at stopping smoking or the flu vaccination or doing physical activity or even taking drugs. So that's quite interesting, and it recognizes basically that in the medical evaluation and screening, we should probably routinely include variables that are related to social well-being, and it shows really the importance of this. But what are these, what we mean by social relationship? I mean, everybody can look in their life if these are how satisfactory these could be. It's about receiving a true support, but also the perception that we can have if we feel like supported, both not only in a tangible way, but also emotionally if we get support, or it's not only a sense of being like married or with a family or living alone, but it's more complex. It's being a part of a society, of having a social role, engaged in some kind of social activities. So I would have liked to make an exercise with you, but I think we don't have enough time. But just for you to know that if you want to like the type of questionnaires that are done to address these and to measure this social interaction is basically from if you can reply and look at your life, and if you feel like satisfied with the frequency, the quality of the social relationship you have, now you can have on a scale of 1 to 5, when you have 1 like not at all satisfied and 5 is excellent, I'm completely satisfied, where 3 is in the middle, I'm moderately satisfied of my relationship. You can have already an idea of how you are doing with this aspect in your life. And the COVID-19 crisis, it's a good example also. I mean, we have been quite isolated, and it's an interesting reflection in this sense. So then I would like to show just another study, which is on the relation about the job strain and mortality. And here stress has been seen also as a measure risk factor. And in this study, which is around 7 cohort studies in Europe, it's seen that in men with cardiovascular diseases, mortality rates are substantially higher when people are under job strain. So which means that they have low control over the job, but they have high demand and also a little reward. So this puts people under stress and with an impact on health. So what this study also showed is actually that this excess mortality is noted also when the people have a good lifestyle, or they are under medication. So still we are seeing this excess of mortality, which means that if we are going to tackle these diseases in a conventional way, we are not going to mitigate this mortality risk. So we need to address also the stress of people and how this is happening. Which are the reasons, etc. So, but till now, I'm showing just a very unidirectional perspective, where, you know, we usually put associations between two variables, and we see how, you know, we increment one variable, and what is the relationship between one and the other one. But we need something more to see, like the complexity of the many factors that are interacting. So one interesting study on that, about stress actually, is one very recent in 2019, which really shows that there is a bidirectional relationship between stress, diet, the composition of our microbiota, intestinal, and the immune system. And this study basically what is saying that under psychological stress, we can be like more urged to consume certain unhealthy food. So it promotes the consumption of unhealthy food, like with a lot of sugar, processed food, trans fat, and saturated fat. And this is actually changing our composition of the gut bacteria. But the psychological stress has also a direct effect on the composition of our microbiota. And this is triggering inflammation and the release of other toxins, which are on the side altering on their way in turn again our mood with the stress, and altering also behavior and promoting, so again, this unhealthy eating. So this shows how this is quite complex, and there are bacterial species that have been found that are really encouraging also, let's say, a dysregulating eating. So to go further into this, this is another very recent study published in 2019 in Science. And it shows actually that not only stress itself, but the role that the microbes in our gastrointestinal tract has on behavior in general. So actually, there is what we call the microbiota gut-brain axis. And this is influencing the brain physiology and behavior on the other side. So I'm not going to explain you because I'm not an expert on this, but I find it very interesting that the social behavior is basically led by interconnected brain regions. And this is affected by a set of factors that can be internal, but also, for example, if we look at diet that we have here, the use of medication, antibiotics and others, and environment are actually factors that are triggering a change in our microbiota, which is then indirectly modifying our behavior. So if you think, for example, diet and environment, there is a link between the microbial diversity and the environmental biodiversity. So the richer and biodiverse is the environment from which we take the food, for example, the richer will be our microbiome. And the richer is our microbiome, the better is our immune system that can defend us. So all these things are strictly related, and show how, for example, intensive agriculture today is going against all this equilibrium and putting in danger really our equilibrium in terms of health. Having now this picture, I would like to show you what was proposed already in 1970 by Engel, a biopsychosocial model, where actually human systems are put in relation with the environment and animals. And what he shows here, it is that like the interactions that can that happening at the micro level, at the micro level, and at the macro level. So at the micro level, we have like interaction with the molecules, cells, organs, which happens also in animals, and in the environment, the same with the chemical and physical molecules. And this is we have an interaction also at macro level in terms of how we interact together in families, communities, nations, and the global society. So this is very interesting, and it shows already the model of One Health. So this is why I'm considering that we need a complex model of an expanded One Health approach to tackle the problem of today, where we have interconnection between human health, animal health, and environmental health. But in this approach, what I am proposing, also we are proposing in our project, is to put at the center the socio-economic system, because the socio-economic system is in reality affecting the environment and the animal world. We know already this with deforestation, with our agricultural practices, etc. But also the human health in terms of the social determinants of health that we were talking about. So that this is a strong view to think about how we are organized in our social and economic communities, and how we can change this. So now this is really at its infancy, because this approach has been originally proposed just for zoonotic diseases. And now what we are saying that it's ignoring the chronic diseases, urban environment, and the social determinants. So the key point to make into practice this framework, it's first of all, we need collaboration between many different sectors and experts. We need just to work together. We need interdisciplinary approaches. We are talking about multiple scales, because we need to go from global scales to how this is affecting till the local level. And One Health thinking is also very holistic, inclusive, respectful, tolerant. So we have a number of challenges if we want to propose an integral approach to health. So this is, it's just in its infancy. What I know that there is a network for evaluation of One Health at European level, which aims basically to develop a framework, protocols, and to be like a platform for exchanging experience, methods, collaboration, participatory approaches. in order to see how we can go ahead. One important point is to get this idea further and to convince also other policymakers, decision makers in general, and the importance of these aspects. I would like what we are doing in BC3 now, in different projects. We are developing this framework, like to finding also concrete way of application. And these are like, I put here 4, maybe there are more, but 4 main projects or research ideas on which we are working. So one, it is on a LIFE project, Urban Clima 2050, on which we are working with our local environmental agency, who is coordinating this project. And basically BC3 here is working on integrating this broader concept of health into urban planning, because you can imagine any type of decision that is made in the urbanization context can affect all these aspects. So what we want to do is how we find a way to integrate this, at which level of the planning, and also to analyze the health impact. We don't want to really to calculate and quantify all the aspects, which would be quite difficult, but also just to find out, for example, where do we can put green areas and parks in the city, because usually these are also in places that are in the richest part of the city. So it's interesting also to put this variable of social justice in this context. Another project, very quickly, is on the antibiotic resistant. This is a project financed by the Elkartek in the Basque country, where basically the problem of antimicrobial resistance is related to the fact that bacteria, viruses can change over time, so they will not respond to medicine anymore, and this is going to be a bigger problem. Here, as BC3, we are using this concept to look at the perceptions of farmers towards the use of antibiotics, doing different classification of farming practices, and we are interested to see which are the problems and barriers in the reduction of the use of antibiotics. We have another idea which is not which is still a research idea and is not a project financed itself, and it is to work on the neurodegenerative diseases, on which I mean, I collaborate with Carolina, but also with Achukar, which is a center of neuroscience in the Basque country. Because neurodegenerative diseases are a big problems in terms also of social burden, and we want to link it with many different environmental pollution. So finally, there is a PhD on environmental justice, where we are looking to see which are the drivers behind that can hinder basically this approach. What are things that are not working in terms of social drivers, economic drivers, environmental drivers, because the current crisis is getting even more and more difficult to implement these ideas of One Health. So with this I conclude, and thank you for listening. I don't hear you, Carolina.
Okay, yes, hello, hi.
Pedro. Okay.
Thank you.
I was struggling to find my unmute button. Thank you very much, Aline. It's a very interesting presentation. It's also a very ambitious research project or theoretical model. I quite like the idea of not studying the environment as a separate thing. Sometimes I think, especially in the media, I know this will not be news to you, but especially in the media, there is often a temptation to reduce the environment to individual choices. If you eat this, if you consume that, you will change the system, but that's obviously not the case. It's collected to the socioeconomic system, to other, even to, as you said, microbial and other levels. So this is very interesting, and I think that there's a room here for discussion. I mean, we can continue the discussion in English, of course. There was the presentation. I think if someone wants to ask a question in Spanish, that would not be an issue, but as much as possible, let's continue. I see that Davide already raised his hand. So
sorry, maybe you could stop sharing the screen so that we can...
Okay, yes.
Probably a good idea.
Yes, of course. Okay.
I see that Davide has his hand raised. So Davide, the floor is yours. That's your question.
Hello, good morning. Thanks very much for the presentation. Very interesting. I was wondering whether you would articulate a bit more on a lot of your presentation dwells on the idea of lifestyle. And I wonder whether you would articulate a little bit more on the differences, especially in terms of policy, where lifestyle is not a choice, and therefore, the health consequences related to unhealthy environment or unhealthy lifestyles are not really dictated by choice. How do you see that fitting in your context? I suppose that the kind of policy implications and prescriptions would be different, and I'd love to hear your opinion about that. Thanks.
Yeah, so you mean that, policies that are affecting lifestyles I mean, the changes that are needed for this are quite important because, I mean, what we have seen, it is currently what we are doing is what we hear that is doing is about sending messages about, for example, diets, eating more fruit and vegetables, or we have to do more physical activity or things like that. But of course, this we have studied about this, that these choices are basically linked to other determinants like income of people, which is linked then to their education. So the habits and the idea to change this lifestyle is going to be much more difficult in this situation. So really, from a policy point of view, I think that it's what we need to change. We have to propose we have to get heard, first of all, by the population. We have to propose approaches that can make a sense. And what is really difficult is when we, I mean, how we are going to change this. I think it's a collaboration between different institutions and proposing a reorientation, basically, of policies is not going to be more easy because the socioeconomic system where we are living, we are like in a consumerism system with choices that are related to more consume of goods and services. So how we are going to integrate these different concept is going to be quite difficult. So I don't really have an answer on how we are going to change this, but it is very important at the broader level that we try to enhance collaboration, participation with different stakeholders, and try to change the view in reality, because if policymakers are able to understand the difference about this, the hope is to find out ways to reduce these social determinants of health, and yeah, having another choice of different proposals. I mean, I don't really have an answer on how we can go through this change, because it's going to be very, very difficult, and also in a situation of climate change, where is hindering more and more all these aspects, how we are going really to address these difficulties and make a change. It's also a personal responsibility. Lifestyles are not going to change very, very easily. So it's a common change I think we have to do between the population, everybody, and the working together at a different level of the organization, I think, political or of the administration.
Thank you very much, Alina. Carolina, you have a question?
Yes. Well, thank you. Thanks, Aline. It was fascinating, and I had like a follow-up question, because one thing that follows from all of your presentation is that, well, all the institutional design, and particularly the healthcare system design, was thought or framed by a conception of health, like by the old conception of health. And you've taken us through the history of how health was perceived. So our healthcare system has been designed to address problems, mainly infectious diseases, which is what used to kill people decades ago. And now it seems with all this new approach that you have shown, and what are the main diseases that are affecting the population nowadays, we don't seem to have institutions designed to address these problems. So I think it follows from your presentation that one of the big challenges we have ahead is one of institutional innovation and design. And I wanted to ask you whether you had anything to add on this, or you're working at BC3 Research on helping policymakers and institutions to adapt to this new paradigm, so to speak.
So we are not working really. These are just ideas. I mean, of where we should go. Institutionally, there is a huge work ahead on this, because what is need to be changed is also in the practice of the medicine. When we go to the doctor and we have a disease or something, the way that this is tackled is quite in the old way, where we are looking just the absence of disease or not, the traditional way. So we are not in reality incorporating all these more the views where lifestyles is also there actually. So I think that there we have a lot of work ahead that is starting from the bottom level at the educational level. So already from the point of view of the medicals, the doctors and medicines. So how this should be approached differently to incorporate, for example, information about, you know, how are social relation of people, how is your health like in a more holistic way. So how we can do this institutionally, this is to decide to see how we are going to really go ahead with this, but we need to start to talk about this. This, I think, is the most important message. I don't have an answer really on how to apply all these in concrete terms, because you know, I'm just putting together things that are related, and the idea is to start thinking about how these things are actually like this, and maybe everybody can do something in their own life, really. So this is the best I can say. So the changes at the healthcare system have to go through all from the macro level to the micro level. I think education is a big chance. One thing I would like to add that is coming now into my mind, also about the lifestyles, is the role of education, really, that from the childhood, because the development of the child is really very important in the way how things are learned. So I think the educational system is not really very well structured in the current system. So, for example, we need to introduce ways of how we can manage these emotions or stress, but already from a child, because then you are already at some age, you are adult, and you are struggling in order to try to manage this. While if this is a learning process from the childhood, of course, is going to be better, and it's going to be integrated from the childhood. So it's not something only of the healthcare system, it's everything. I see it's related, so we need to change everything. From where we start, I don't know, really. So I think we need to start talking about it. We need to start sharing this information at different levels and trying to make little changes. I would say that a platform, for example, on this, where we can share different experiences, it's interesting. On our side, what we do is to work with some research project with some local departments of administration, where we can really try to put this into a concrete practice, like in urban planning, for example, working with the health department.
Thank you very much, Alina. There's a question that was asked in the chat by Diana Carolina Velasco. So of course she praises your seminar and your presentation, and she says, since you were mentioning the importance of Diana, I don't know if you want to ask the question, so I'm just reading it because you put it in the
no, it's okay. I don't want to take time about it, but yeah, it's basically, thank you for the presentation. And I was wondering, since you were connecting the socioeconomic system with the environmental one and the health system, it requires a lot of awareness of regarding the population and the relationship between individual behaviors and then the collective behaviors. I was wondering if you've thought already about some kind of methodologies or ways to approach the population to create this awareness, and ways to put them into action, like to mobilize, change their lifestyles.
Thank you, very good question. So we, in one of the projects on antimicrobial resistance, for example, what we plan to do, and it's part of let's say a way to raise awareness, is to interview, but not with just an interview, you know, like 50 minutes, but taking some more time to go deeper into the relationships about, you know, what they are doing, the use of antibiotics, the barriers that they can be seen, for example, in reducing the use of of antibiotics in livestock. So one idea is to work through questionnaires into specific projects where we try to convey more and more information. The difficult thing in this case is to arrive to those farmers that are, let's say, less organic and ecological, with a mindset more towards, exploitation. That's more difficult, but this is our challenge. So one way is this one, to raise awareness. Another one is to work with the citizens, doing also surveys, in which we're trying to raise the awareness of the important links with the environment, with some concrete experience or some concrete data. So basically on our side, little by little, it's more through research projects and survey analysis.
Thank you very much. Anyone else has an answer, has a question? Actually, well, in that case, I'll use my privilege as moderator and ask one question. I mean, I did actually have one which was about the operationalization of the model, but you already, to a certain extent, answered it, because it is, of course, we all want our models to be very comprehensive, but it is a challenge to then turn that into actual, into a research project. The other question I have then is more, I'd say, of a broad question. So, I mean, one of the things that environmentalists have been saying since the 1960s is that the problem is not a specific technology or a specific product. It's the technology itself. It's the fact that we have all this development that's based on technology, increasing technological development, increasing growth. So I would just like to know what does this model have to say about that? Are you a techno-optimist? Do you think that a lot of the problems we have can be solved with just better technologies, changing the system, or are you more of a fundamental, take a more fundamental, critical take on the current economic development model?
Yeah, so I mean, this is everything to work and to work on. I mean, it's not something I'm proposing myself on my own. It's an idea that needs interdisciplinary and a collaborative discussion around this. So technology, I am a bit less prone to consider technology as the solution of everything. I'm more in the middle, in the sense technology can help in something and in other things less. So it's all about a moderate use. Of course, if we think to continue to have the same type of life and the socioeconomic system itself is continuing in the same line, we cannot think to solve our problem with technology. This is quite clear, and this is not the aim. I mean, it cannot be integrated as a view in this approach. So I think technology can enter in this as long as it respects the basic relationship between this health as a whole and a balance and an equilibrium. So when technology is going to interfere in this, or if we say the socioeconomic, we want to continue to live in the same way, but we find the technology to solve the problem of either climate change or infectious diseases, that's not the only way. I think it's a collaboration between many things. I mean, for example, it comes now into my mind like some indigenous population which by foraging and they have no agricultural practices, and what has been found by many research is that they have a quite very better immune system that we have, and improve the possibility, you know, to face changes. So they are in a way healthier than we are. So, okay, we cannot go back to foraging, of course, and leaving everything. So we need to find a middle way in the thing. But these examples of indigenous people, I think, are good and inspiring examples. And I would say that it is in the middle, and it's something that we can do between all of us. One thing that I would like to add, that we cannot only blame policymakers, because we cannot blame only policymakers or governments and asking the solution to them and see, okay, how we, I mean, this is like a change that is going to happen little by little. We need a lot of time, and it's a combination between many things, the macro level and the micro level, so the top down and the bottom up. And probably the bottom up might be even more important, you know, changes at individual level, who is able to try to start making these changes and little by little changing. The thing it is that those people that are more disadvantaged because of a lot of, factors that we know, are those people that are going to pay more the consequences during this change. And I don't know how we can change this. I mean, this is a step-by-step process, and in the way of getting better, yeah, that's the thing.
Thank you very much. We are now, it's now 1 p.m. We're 1 hour since we started the seminar. So and since no one has any more questions, I would invite Carolina and Ivan to maybe do some final comments, and we would end the seminar after that.
Bueno, empiezo yo agradeciéndole a Aline su participación aquí como broche de oro de cierre del ciclo de seminarios que hemos organizado con la Cátedra de Transición Energética Urbana. Bueno, como lo has mencionado, aprovecho y lo digo, si el Ministerio de Ciencia e Innovación tiene a bien financiarnos, trabajaremos juntas, bueno, Aline con Ingenio, en algo que nos conducirá a explorar ese triángulo de ciencia, política y sociedad, en un caso de estudio sobre enfermedades neurodegenerativas y políticas y cambio climático, etc. Ojalá sea así. En todo caso, muchas gracias por haber participado en el ciclo y gracias a todos los que estáis aquí y habéis participado en varios. En total el ciclo suma, veíamos hoy, casi 240 inscripciones. Entonces, bueno, creo que ha sido un éxito, sobre todo gracias a los ponentes y a los participantes. Y tendrá sentido reeditarlo, me imagino. Y te paso la palabra a Iván para que comente también.
Sí, yo simplemente muy breve. Bueno, pues agradecer a Aline el seminario, ha sido extremadamente interesante. Pedro también, gracias por la moderación, y Carolina también. Y nada, simplemente por decir que por parte de la cátedra, que yo creo que cuando nos planteamos este seminario, ¿no?, con Ingenio, cuando empezábamos un poco a diseñar cómo podía ser este seminario sobre transiciones a la sostenibilidad, de innovación, tecnología, esta discusión, ¿no?, queríamos poner sobre la mesa una serie de temas que yo creo que hemos conseguido poner, ¿no? Como decías, Carolina, por la calidad de los ponentes y por los participantes y por las cuestiones que se han planteado, ¿no?, en el turno de preguntas en los diferentes seminarios, ¿no? Yo creo que hemos planteado una serie de cuestiones que están muy de actualidad, que están en el centro de la discusión ahora sobre qué rumbo tienen que tomar nuestras ciudades en este contexto tan particular en el que estamos, por el COVID y por todo lo que tiene que ver con la transición ecológica en general y el New Deal y, bueno, el nuevo rumbo, o no sé si nuevo, pero el rumbo, en cualquier caso, que están tomando nuestras sociedades. Y yo creo que estos estos 4 seminarios han sido una intervención muy, muy interesante, tanto en general como también enfocada, digamos, a las cuestiones y a las problemáticas que están en el centro del debate ahora en la ciudad de Valencia, ¿no? Nuestra intención era hacer una contribución a ese debate y seguir alimentando la conversación sobre ese debate aquí en la ciudad de Valencia, en el entorno universitario en el que estamos, y yo creo que lo hemos conseguido y espero que sigamos haciéndolo con futuras ediciones de estos seminarios o similares. Así que muchas gracias a todas y todos por participar y espero que podamos seguir adelante con algo muy parecido a esto.
Muchas gracias. Me sumo al comentario.
Sí.
Bueno, en ese caso, muchas gracias, Aline y Chiabai otra vez por tu intervención y por las preguntas, y terminaríamos aquí el seminario. Muchas gracias.
Gracias a todos.
Muy bien, hasta luego.
Hasta luego.
Hasta luego. Hasta luego.